Hello future doctors, welcome back to the Happy Teeth Club. Please subscribe to our channel. So in this video we will learn about developmental disturbances of tongue. There will be three parts of this topic. In this we will learn about aglossia, macroglossia and ankyloglossia. So first is aglossia. It is very rare and it is associated with hand and feet malformation, also cleft palate. The causes are trauma to the fetal cell during first week of gestation. Here you can see aglossia. The tongue is not formed. Now let's learn the cascade of aglossia. Tongue is very rudimentary, due to which there will be lack of muscular stimuli, which interrupt the transverse arch development. This will affect the anterior growth of mandible and thus causes severe malocclusion. In this picture, you can see microglossia, the lack of development of mandible and severe malocclusion. Next is macroglossia, which is also known as tongue hypertrophy, pseudomacroglossia, and prolapsus of tongue. It is associated with two syndromes, that is Down syndrome and Beckwith-Wiedemann syndrome. Acquired conditions that may cause macroglossia are amyloidosis, hyperthyroidism, acromegaly, and diphtheria. Pseudomacroglossia includes habitual posture of tongue, enlarged tonsils, severe retrognathism, and hypotonia of tongue. Now the etiology of macroglossia. First is dilation of lymphatic, second is muscular hypertrophy, and is inflammation. Now treatment is always surgical approach. Third is ankyloglossia, that is tongue tie. Here you can see. In this, inferior frenulum is attached to the bottom of tongue. It will restrict free movement of tongue. It always leads to speech problem. Here you can see the inferior frenulum is attached to the bottom of tongue. Now the clinical features are restricted tongue movement, feeding problems, speech defects, and of course spacing. Treatment are frenulectomy.